With that, the hearing will come to order. The Oversight Committee's mission statement simply is, we exist to secure two fundamental principles. First, Americans have a right to know that the money Washington takes from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to protect these rights. Our solemn responsibility is to hold government accountable to taxpayers, because taxpayers have a right to know what they get from their government. It's our job to work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the federal bureaucracy. I now ask unanimous consent to the following individuals: the gentleman from Texas, Mr. Sessions; the gentleman from Texas, Mr. Burgess; the gentleman from Texas, Mr. Neugebauer; and the gentleman from Texas, Mr. Vassie, be allowed to participate in today's hearing, even though they are not members of the committee, but are members in good standing of the U.S. House of Representatives. Without objection, so ordered. I'll now recognize myself for a short opening statement. We come to Dallas today, or more specifically to Richardson, Texas, to hold a field hearing on the Affordable Care Act, ObamaCare implementation. Who are the navigators? Over the past several months, as we've begun to and now rolled out the President's signature legislation, the law has faced one after another problem. First, and most notably publicly, over $600 million was spent on a website that simply didn't work. But that is but the tip of the iceberg. We now know there are fundamental unanswered questions, complications, and, quite frankly, flaws in the Affordable Care Act that need to be addressed. The question of administering the website and patching the security holes that existed on launch date and may still threaten the American people's private information is, of course, paramount. But long after the website is fixed, we will still have the question of millions of people who have lost their health insurance, even though the President promised, if you like your health care, you can keep it. If you like your doctor, you can keep him, period. We know that that, in fact, is not going to happen. Many times more people have lost their health care than have gained an opportunity under the Affordable Care Act. That's not to mean that it isn't the law of the land. It means we must fix it. A number of other areas have been explored by this committee, and today we are going to explore a major portion of the Affordable Care Act rollout. Today's hearing focuses specifically on the administration's Navigator program. The purpose of Navigators is to explain Obamacare to people and facilitate enrollment into coverage. This was approved in the law and is anticipated in every sense. However, what has not been anticipated is such failures as to find that somebody who has a history of identity fraud, healthcare fraud, or some other felony conviction might very well receive the job of being a navigator. This and other areas we will hear about today represent areas in which government must do better. The expectation of the American people is that people who represent the power of a mandated law and a service that the taxpayers pay for will, in fact, receive a trained individual with an acceptably clean record and an expectation of their privacy. The HHS training program for navigators will only provide 5 to 20 hours of training, and in some cases, online-only training. The navigators' exams are conducted online, and individuals may attempt to take these exams an unlimited amount of times. As we all know, an online exam also can be taken by somebody else pretending to be the navigator. Despite these expected lack of experiences and lack of training, HHS officials testified that it would be logical for navigators and assisters to conduct outreach activities prior to completing their training. I repeat, even with this short amount of training, even with the training being online, even with the possibility that the person taking the test 1, 2, 10, or 100 times, finally getting someone else to take the test for them. Even though that low standard is there, HHS has said that it may be necessary or reasonable for them to go out in the field prior to this testing and training. One CMS whistleblower warned that because it is not possible to track every computer and hard drive used by navigators to gather applicants' personal identifiable information, the fact is sensitive information may be vulnerable to, among other things, viruses on their individual computers. Top HHS officials acknowledge concerns that con artists, identity thieves, will pose as navigators and testified that the problems will only increase as the Affordable Care Act is fully implemented. We are now 2.5 months into the rollout. We certainly want to hear about things that were wrong at the launch. We, more importantly, want to know, have they been fixed, or are they to be fixed? In Dallas, navigators have been caught on camera advising individuals to commit tax fraud by underreporting income in order to gain higher subsidies. Our committee, more than 2 years ago, dealt with a similar situation with fraud in the housing market that helped contribute to people having homes they could not afford. We cannot have a repeat of the acorn-like activities that led to too many people believing that there was something for nothing and ultimately ending up with nothing when they started with something. Finally, this hearing is titled, Who Are the Navigators? We invited Dr. Beverly Mitchell Brooks, the CEO of the Dallas Urban League, to testify today. The Dallas Urban League received $376,800 in federal taxpayer dollars to fund its Navigators program. Unfortunately, despite repeated requests, Dr. Brooks would not make herself available to testify today. We are anticipating a Democratic member of the U.S. House being here, and I would like to publicly express that that's a good thing. We need to have a diversity of opinions. We need to have people who are working and believe that this program has sufficient merit to go forward with, and hopefully would contribute positively to the dialogue of those items which can be fixed on a cooperative basis. Notwithstanding that, we'll go forward with the hearing and allow additional information, including Dr. Brooks's testimony, to be placed in the record if she so wishes to submit one. I now, with great pleasure, recognize my colleague and fellow member of the committee, Subcommittee Chairman Farenthold. And I'll give you the mic.
Thank you, Chairman Issa. It's an honor and a privilege to be here in Richardson, Texas, to be a part of this very important hearing. My wife grew up in Richardson, so it's great to be back. Unfortunately, this area is also ground zero of some of the problems that are beginning to appear with the navigators. We have the tape that the chairman referred to, and what we're doing here today as government watchdogs and in partnership with various outside organizations we're looking to find ways to make the system better. We're looking for ways to protect taxpayers. Unfortunately, under the Affordable Care Act and the way it's being implemented, it really appears that folks' private information is going to be in jeopardy, be it through problems with the website or be it through navigators. Even the most conscientious navigator may not have the tools necessary to keep the data private. So we've got a real problem here that we need to look for a solution for and look for a way to protect folks' information. Unfortunately, we're losing trust in the government. We've had such a plethora of scandals in recent months that the American people are losing confidence in their government, and that's a bad thing. I mean, we can look to Fast and Furious. We can look to Benghazi. We can look to the IRS scandal. We can look to the broken promises of if you like your health insurance, you can keep it, period. And Americans are losing faith with their government. We've got to make efforts to regain that faith, the faith of the American people. people, and we've got to work towards good government and transparency. That's part of what this committee does, and it's my honor and privilege to be a part of it, and I'll yield back the remainder of my time.
Gentleman yields back. Thank you. And we now go to the chairman of the Rules Committee of the U.S. House, and the reason that we're here today was an invitation to hold this hearing in the Dallas-Fort Worth area. Mr. Sessions.
Mr. Chairman, thank you very much and good afternoon. And I do want to begin by thanking you, Chairman Darrell Issa, the chairman of the Government Reform and Oversight Committee. This is one of a series of field hearings held across the country that Chairman Issa and other members of Congress have participated in, which lead the investigative shortcomings of what is known as the Affordable Care Act, or Obamacare. And I appreciate your leadership on this and so many issues that are important to the American people. I would also like to thank today the City of Richardson, Mayor Laura Masca, the City Council members, as well as the people here at the Eisman Center in Richardson who have made this not only a great place to be, but their hard work that was included also. Additionally, I'd like to thank my fellow members of Congress who are in attendance today. As you've heard, Congressman Blake Farenthold from Corpus Christi, who is a member of this Government Reform Committee, here to lend his expertise and ideas to this hearing. Congressman Michael Burgess, a member of the Engineering and Commerce Committee and the Rules Committee. I also want to thank the gentleman Randy Naugebauer from Lubbock, Texas, who is here, who's graciously agreed to be here as part of this panel. We also recognize that Congressman Mark Vesey, a brand new member of Congress, who responded that he would be here today, and I fully expect that he will in a few minutes. I would also like to thank our witnesses who are in attendance today. We have the gentleman, Mr. Kevin Brady, Deputy Chief of Staff of the Department of Insurance for the state of Texas. Dr. Randy Ferris, my friend from Centers for Medicare and Medicaid Services, and Carolyn Goodwin, President-elect of the Texas Association of Health Underwriters. Signing up for health care is one of the most important and daunting tasks that Americans do today. Unfortunately, over the last few months, what is known as Obamacare has made an already difficult process even more confusing and daunting for America's families. Initially, President Obama promised that if you liked your health care plan, you could keep it. Since then, millions of Americans have received cancellation letters informing them that they can no longer keep their preferred health insurance plan. President Obama also promised the American people that if they liked their own doctor, they could keep their own doctor. In reality, many people all across America are losing access to their existing and preferred doctor under Obamacare. But the confusion does not end with the administration's broken promises. As Americans are forced to choose new health care plans, they're facing higher premiums, as I do as a member of Congress, where my health care, exactly as I had it before, is doubling in price, and I have a new $2,000 deductible, higher out-of-pocket costs, and changing networks. The American people are frustrated with these changes, and it is simply adding to the confusion surrounding their health care. And then we heard this, and I would have you look at the screen.
Enter the conservative Project Veritas group, Veritas meaning truth. It sent an undercover person to the National Urban League offices in Dallas and Irving, Texas. The Urban League is receiving more than $1 million taxpayer dollars to guide people into the Obamacare system. Some of that money is being used to hire so-called navigators, so when you call up, they can help you. The Project Veritas Undercover talked to a few of these navigators in training. First, about what to state as income.
The other stuff I do is like barber, or I'll go and clean houses and things like that, just to get extra money on the side. But I never filed that type of stuff on my
You filed taxes?
About my taxes.
How long are you supposed to file a percentage of it?
A percent.
Yeah, but you're making money on a cash basis.
Okay.
Don't get yourself in trouble by declaring it now.
Exactly.
Yeah, it didn't happen.
Yeah.
Yuck, 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 huh? So that navigator in training suggesting fraud. On another occasion, the Project Veritas Undercover asked about smoking.
Oh, one more question. They have, I don't know where it said something about if you smoke or something like that. But I really don't smoke. I may
lie because your premiums will be higher.
You lie. So
Mr. Chairman, after learning that navigators here in North Texas were actively encouraging applicants to lie on their applications, I ask you to hold a field hearing of the Government Reform and Oversight Committee to help us to better understand who are these navigators and what is their role. I look forward to the testimony that we hear today to help us not only to better understand this program, but to hold accountable the people who are hired with federal money and who really represent the American people. Mr. Chairman, I yield back my time.
I thank the gentleman. We now go to the gentleman from Texas, Mr. Burgess.
Welcome.
I want to thank the chairman of the Oversight and Government Reform Committee, the chairman of the Rules Committee for calling this important hearing and allowing the committee to hear how the Affordable Care Act is specifically affecting Texans. I've heard from a lot of constituents about how the Affordable Care Act is having employers drop health coverage for their employees, raising premiums, and preventing individuals from keeping their doctor in their health plan. The president promised if you like your plan, you can keep it. If you like your doctor, you can keep your doctor, and that the law would cut annual health insurance costs for a family by $2,500. We now all know that that was not true. In the midst of these broken promises, even more concerning is the issue that federal officials have assigned much of the responsibility for education and outreach to federally funded navigators. $67 million, $13 million more than originally budgeted, has been given out to navigators across the nation, all at the taxpayers' expense. So it begs the question, who are the navigators? And as your representative for the people in Denton County, I'm responsible to ensure that my constituents are protected and that their money is well spent. I'm concerned that the navigators are not properly vetted or trained. The federal requirements to become a navigator are inconsistent, opening individuals up to possible abuse of personal information. In an effort to address this issue further, several members of the Texas delegation, in fact, I think most of the Republican members of the Texas delegation, wrote a letter to Governor Perry encouraging that the governor use his authority to ensure that the navigators that operate in Texas are properly vetted, trained, and certified. So I certainly welcome our witnesses today. Dr. Ferris, it's always good to be with you. We've had an opportunity to visit several times over the past 11 years, and I always enjoy the time that we get to spend together. But I welcome our witnesses to Richardson, and I'll yield back my time.
Thank you. We now go to Mr. Neugebauer. By the way, my chief of staff is Neugebauer, and I apologize. I've been doing that to you for a decade. Thanks, Randy.
Thank you, Chairman Issa, and it is good to be here in Richardson, Texas, also in the home district of my good friend Pete Sessions, and I appreciate the chairman taking these hearings out to the American people. There's probably no greater responsibility that members of Congress have, and that is to do oversight, making sure that the government is doing what it's supposed to be doing and do it in a way that's effective and doing it in a way that is in the benefit of our country. And, you know, we've had a lot of hearings and a lot of discussions in almost a number of our committees about the Affordable Care Act, or ObamaCare, as it's referred to. Just recently, I'm on the Science Committee as well, and we had a hearing about the website. And as you know, the website has had a number of problems. Obviously, people still having a difficult time getting into the website, but I think one of the more troubling things to me was to learn that this website may be vulnerable to attacks, cyber attacks. And why is that important to you and the American people and families all across the country? It's because some very sensitive information is being put into this system. And so basically, if people can hack into these systems, then they can get access to personal information of families and basically possibly have their identity stolen. The other thing that's going on, and we won't be a part of this hearing today, but it's the discussion that we're hearing from hundreds of letters that I know I'm getting in my office, and I think other members are too, and that is that we're learning that all of the promises that were made about Obamacare aren't coming true. We're hearing stories about, families losing access to the health insurance policy, for example, that has been taking care of their little girl that has cancer. We're learning that the premiums that were affordable to some families in the past now are not going to be affordable in the future. We're also hearing, unfortunately, about families that are going to lose access to maybe a family physician that's been serving that family for 20 or 30 years, and now that physician will no longer be a part of their plan. These are very unfortunate things and affecting a very sensitive and a very important part of American families, and that's their health care. So I think this is an appropriate hearing today. One of the things that concerns me about the navigators, and we want to learn more about this program today, is that basically we have people that aren't being really vetted, that are going to be accessing very sensitive information about families, about their Social Security number, about their income. And so what happens when they have access to this information? If they wanted to use it in an inappropriate way, they could basically steal someone's identity and basically impacting their credit and their future. And so I think it's important that we know what's going on, what's being done. I want to applaud the governor and the state legislature for the things and steps that they've taken to make sure that people that are doing this basically have some standard. What we're going to also, I think, hear today is that, the people that, as a profession that advise people on health care have to have a lot more training than these navigators are. And why is that important? Because this is a very important decision. And one of the things we want to make sure is that families have the information necessary to make the very best decision on their behalf. I thought it was interesting when some of my people in my district began to learn that their identity could be stolen. And one of my constituents wrote me a letter and said, and I quote, "You mean this is going to be another promise? If you like your identity, you can keep it?" Well, let's hope that the president this is a promise that he can keep, because that's a very important part. And so, Chairman Issa, I want to commend you for the oversight that you and your committee have done, as well as some of the other committees, because the American people deserve this kind of oversight. This is in their best interest. And with that, I yield back.
I thank you for your kind comments. The gentleman yields back. We now go to the gentleman from Texas, Mr. Vesey.
Thank you, Mr. Chairman, members and witnesses, and also want to extend a warm welcome to the members of the committee, particularly from out of town, for coming all the way to Texas for this very important field hearing. I'm glad to be here today because I would like to tell you a little bit about how the Affordable Care Act is helping constituents in the district that I represent, the 33rd Congressional District of Texas. I represent the congressional district that has the highest number of uninsured in the entire country, or the highest rate of uninsured in the entire country. Some of the insurance companies have discriminated against them because they had pre-existing conditions. They have been allowed to charge women more than men in many cases, and they have been allowed to sell junk policies that collect premiums up front, but then don't pay for individuals' hospital bills when they get sick. But now that the Affordable Care Act is the law of the land, it has already begun helping them in many ways, and it will help them even more in the weeks and months and years to come. Here in Texas and all across the country, millions of adults now have health insurance on their parents' plans. They can stay on until they're 26. Millions of children with pre-existing conditions will no longer be denied coverage. Tens of millions of seniors have already received free preventive services, including new annual wellness visits, and consumers have received rebates from their insurance companies, which are now required to spend at least 80% of premium on health care. I understand that today's topic is specifically about the Navigator program, and I know that the purpose of this program is simple. It's to educate and enroll citizens in health insurance. Reducing health care costs requires that everyone be covered. And that everyone be in the insurance pools. So navigators help people get health care coverage, some of them for the very first time in their lives, and that helps them to lower health care costs for everyone in the country. The model for this enrollment effort is well established. A very similar model was used here more than two decades 2 decades ago to implement the state's children's health insurance program. The Texas Navigators are trusted. Their community organizations and nonprofits such as the United Way and the councils on the aging. They're also the churches in our neighborhoods and the chambers of commerce. Last month, when CMS was made aware that some employees of the Urban League of Greater Dallas encouraged applicants to provide false information on applications, they immediately decertified the 2 individuals from participating in the Navigator program. Of course, everyone here agrees that no one should ever tell applicants to lie on their forms. And that is why I was encouraged that the Urban League and CMS took swift action in firing those who engaged in that activity. They give this program a bad name, but make no mistake, they are the exception. They are not the rule. So while I'm happy that the committee came to Texas today to talk about these individuals, now that you're here, I hope that we can talk about a much more significant problem, and that is why our governor, Rick Perry, is refusing to expand the state's Medicaid program. We desperately need Medicaid expansion in this state. The governor is refusing to accept billions of dollars in federal assistance that we so desperately need. And why he is doing that, I can only imagine that it's for purely political reasons. Governor Perry has denied those constituents that I talked about earlier, where I have the highest rate in the entire country. He's denied them coverage. Under the Affordable Care Act, the federal government would pay states 100% of the cost of this expansion the first 3 years and 90% after that. And yet the governor would rather leave $9 billion on the table for our health care that our state desperately needs. So, Mr. Chairman, thank you for coming all the way to Richardson, Texas to hold this hearing about a handful of people that we agree absolutely have no place in this program. But it's high time we start talking about the millions of people right here in this state who absolutely have no insurance at all, and they're being denied coverage under the Affordable Care Act. Thank you.
Thank you. I would caution the audience that neither positive nor negative is encouraged during an official hearing. Members may have 7 days to submit additional opening statements and extraneous material for the record. We now recognize our first panel of witnesses. Mr. Kevin Brady is the Deputy Chief of Staff at the Texas Department of Insurance. Welcome. Dr. Randy Ferris is the Regional Administrator for the Centers for Medicare and Medicaid Services. Thank you again for being here. And Ms. Carolyn Goodwin is the President-elect of the Texas Association of Health Underwriters. Thank you also, and if you would all, pursuant to the rules, please rise to take the oath. And raise your right hands. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Please be seated. Let the record reflect that all witnesses answered in the affirmative. In order to allow time, we have given you the universal red, yellow, and green that we all drive by. Red, of course, means go. Yellow means go even faster. And red means you didn't make it through the light. So if you try to stay within that 5 minutes, we'd appreciate it to leave more time for answers. I won't cut anyone off mid-sentence, but bear in mind that your entire opening statements will be placed in the record, whether you stick to those or not. So with that, I recognize, I'll recognize ladies first, Ms. Carolyn Goodwin.
Thank you very much, Mr. Chairman. I appreciate the honor of being ladies first. And I need to correct your record. I'm not the president-elect of the Texas Association. I've already been there, done that. I'm the president-elect of the Dallas chapter.
The record is hereby corrected.
You have my written testimony, and I don't want to take the time to read it, but I do want to add some additional comments to that testimony. For those in the audience, I've been in the insurance business for slightly over 20 years, and my job is to help small groups and individuals uncover the maladies and the benefits of health insurance and help them meet their objectives. There are a couple of things that I would like to talk about with regard to what's the difference between a navigator and an agent and broker, which is what I am. A navigator is hired by one of the agencies They're an employee who has a job. They work with people either on the phone or help guide them through the website. Agents and brokers do the very same thing. We do it in the private marketplace, except that there are 70,000 agents who are now certified to work on the marketplace itself. Now, the difference between me and a navigator, I have to have 40 hours of education. That's to get my license, and then I have to take 30 hours of continuing education every 2 years, including professional ethics, to keep my license. And I must promise the carriers that I will be forever honest and true. I also have to carry a professional liability policy that's probably $1 million in face value. And if I do something dishonestly, I don't lose my job. I lose my livelihood. I lose my license. I can't do what I do today. If I disclose PHI, that's that protected health information, and I do it for profit, I can go to jail. If one of my client employers does the same thing, they too could go to jail. So there is a significant amount of risk to us to act the way we do. Now, do we just sell insurance? No. Much happens after the sale of the policy, and I'm going to give you an example of what happened to me last week. I have a very dear friend who has an individual policy, and for some reason the systems in that policy said she had no prescription coverage. She was on hold with the carrier for over 2 hours without result. She came to me, I called the company, I got it corrected, and she had her prescriptions within 30 minutes. That's what agents do on a daily basis. I don't think navigators have that ability. They can't talk to the carrier. They can't solve the problem that the insured has. If I could make one political statement, the Affordable Care Act is not the promised health care reform. It is health insurance reform. The cost of care and the increasing mandates, both at state and federal levels, continue to drive the cost of insurance. And until those items are addressed, we're going to have those escalated premiums over and over and over again. Nothing has been done to control the cost of care. Everything has been done to tell insurance companies how to run their business. I think I'm done.
I thank you. We now go to Dr. Ferris.
Thank you, Mr. Chairman, and good afternoon, Mr. Chairman and members of the Texas delegation. Thank you for the opportunity to discuss CMS Affordable Care Act outreach efforts, including the Navigator program. The Dallas Regional Office plays an important role in working with community and consumer groups, providers, and other stakeholders throughout the region to ensure that people understand the Affordable Care Act and their new coverage options. Over my 15 years at CMS, I've very much appreciated the opportunities to work closely with many of you, as well as your staff, on critical public health issues like emergency preparedness, nursing home safety, quality improvement, and Part D enrollment and outreach efforts. During the Medicare Part D rollout, we worked extensively with bipartisan congressional offices to help seniors understand their new options and sign up for prescription drug coverage. These efforts included participating in congressional town halls, meeting with medical societies and editorial boards, and helping with constituent casework issues. The Affordable Care Act requires similar types of outreach. CMS is pursuing a variety of ways to provide outreach, education, and enrollment assistance to the uninsured and others seeking coverage through the marketplace. The Navigator program enables qualified and well-trained individuals and organizations to help consumers find and enroll in health care coverage while adhering to standards and requirements designed to ensure that taxpayer money is used appropriately on these programs. Navigators are helping consumers prepare electronic and paper applications to establish eligibility, to find out if they are eligible for affordability programs like premium tax credits, cost-sharing reductions in Medicaid, and enroll in coverage through the marketplace. Navigators also provide outreach and education to consumers to raise awareness about the marketplace. As Texas has one of the highest numbers of eligible uninsured residents in the country, 8 grantees received nearly $10.9 million in federal Navigator grants for work in the state. These grantees are groups and organizations with a proven ability to reach out to likely marketplace consumers in their local communities, many of which are located in the Dallas-Fort Worth area. For example, the United Way of Metropolitan Tarrant County has served the people in the Fort Worth and Arlington area of Texas for over 90 years and is working across the state to promote enrollment in the marketplace. The Navigator Grant Program, its application process, its terms and conditions, and program oversight are informed by the Department of Health and Human Services' experience with grants management. Navigators are trained on providing consumers with fair, accurate, and impartial information, along with training on standards to keep consumers' personal information private and secure. Marketplace navigators have regular refresher opportunities where they can share updates, receive information, and address issues as they're in the process of helping people in their communities. CMS takes allegations of suspicious activity and fraud seriously and actively monitors complaints about potential wrongdoing. Last month, CMS was made aware of incidents in which employees of one Navigator grantee, the Urban League of Greater Dallas, instructed consumers to falsify information on their marketplace applications. CMS took immediate action to officially decertify the navigators identified in the videos and to inform the National Urban League and its sub-grantee in Dallas that they were non-compliant with Navigator regulations. CMS issued a detailed corrective action plan outlining the remedial actions that the National Urban League must take to continue as a federal Navigator grantee. The National Urban League responded by suspending the employees involved and has fully complied with the new requirements. CMS also quickly issued a corrective action plan to Houston-based Navigator, Change Happens, when a second incident of improper conduct by an individual navigator was brought to our attention. CMS has alerted all navigators operating in the federally facilitated marketplace to emphasize that encouraging consumers to provide inaccurate information is against the rules of their agreements and could potentially subject the navigator and consumer to prosecution. CMS will continue to vigorously monitor Navigator grantees in the federally facilitated marketplace to ensure that funding goes to the applicants who are most qualified to serve their communities in this capacity and to ensure that they are well-trained, meeting objectives, and using grant funding appropriately. Thank you for the opportunity to speak today on this important topic, and I will be happy to answer any questions that you have.
Thank you, Dr. Ferris. We now go to Mr. Kevin Brady.
Chairman Issa, members of the committee, members of the Texas delegation, my name is Kevin Brady. I'm here today on behalf of the Texas Department of Insurance. Commissioner Julia Rathgaber wanted to be here today, but unfortunately she had a prior engagement. She sends her apologies and included a letter to each of you, which is included in the packet of information that we provided. I'd like to thank you for this opportunity to be here today to talk about some proposed rules that my agency has published for public comment on navigators. I'd like to take just a moment to talk about TDI by way of background. Texas Department of Insurance is known as the acronym TDI. We're charged with being the primary regulator of the Texas insurance market. We're charged with ensuring fair competition, and we're charged by law with protecting consumers. In 2012, Texas consumers and businesses bought over $121 billion in insurance premiums. We believe that makes Texas the 12th largest insurance market in the world. To help put that into context, it's about the same size as the entire Canadian market. We have over 1,900 insurance companies licensed in Texas. The number increases to over 2,200 when all insurers with any type of eligibility are included. The market also includes over 400,000 agents and other licensed entities. During the 83rd Texas legislative session, lawmakers passed and Governor Perry signed Senate Bill 1795, which requires the Commissioner of Insurance to set standards ensuring that navigators can perform their required duties if the federal standards are deemed to be insufficient. TDI has worked diligently to ensure a deliberate and transparent process throughout the implementation. of this bill. We held an initial stakeholders meeting in September. We followed that with numerous teleconferences with navigator groups, consumer groups, healthcare providers, and also the Department of Health and Human Services. We also posted a proposed outline of potential solutions on our website for potential insufficiencies that were identified by agency staff. And the resulting rule proposal was published in the Texas Register on December 6th. The proposed TDI rules are necessary to provide a state solution to help and protect Texas consumers by ensuring the security of their private information and ensuring that they are able to find health coverage from the federally facilitated exchanges with the assistance of qualified navigators. Under the proposed rules, entities and individuals providing enrollment services in the exchange would be required to register with TDI. The requirement for registration would include proof of U.S. citizenship or other legal status to gain employment in the U.S., documentation of compliance with educational requirements, including privacy and ethics training, fingerprinting and background checks, and evidence of financial responsibility to protect individuals from wrongful acts. Navigators would be prohibited from certain functions, including charging consumers for providing information about health coverage, selling, soliciting, or negotiating health insurance coverage, or recommending a specific health benefit plan. While in the course of performing navigator duties, they would be prohibited from electioneering activities or otherwise supporting the candidacy of an individual for government office. Additionally, Texas Insurance Code provisions related to privacy and the protection of personal information would apply to navigators. TDI is going to hold 2 public hearings to receive public comment. The first public hearing will be Friday of this week, December 20th at 9 a.m. in Austin. The second public hearing will be on January 6th. That coincides with the closing of the public comment period. We would invite all parties to submit comment either at the hearing or in writing to TDI, and the proposals can change as a result of the comment received. Mr. Chairman, I'm going to close with that, but would note that we have additional information in the packages of information that we've provided, including instructions for providing public comment and the actual substantive requirements of our proposed rules. Mr. Chairman, thank you again for this opportunity to testify on our efforts of both the state and the Texas Department of Insurance that we're taking to protect consumers. I'd be happy to answer any questions.
Thank you. On September 18th, this committee issued a preliminary staff report entitled Risk of Fraud and Misinformation with Obamacare Outreach Campaign, How Navigators and Assisters Program Mismanagement Endangers Consumers. I now ask unanimous consent that the update of the staff report released today be included in the record and used for comment during this hearing. Without objection, so ordered. Mr. Brady, I'm a Californian and an Ohioan by birth, so if I miss one of these in the insurance questions, feel free to shame me as much as you want. But you oversee car insurance in this state?
Yes, sir.
Federal government tell you do you have to have unlimited coverage on car insurance?
No, sir.
Do they provide people to sign up car insurance at federal expense?
No, sir.
Do you have workers' comp insurance in this state?
Yes, sir.
Does it provide health care benefits for people injured at work in addition to lost wages?
Yes, sir.
Do they have federal navigators to make sure that people know about this and get all the benefits?
No, sir.
You have title insurance, renter's insurance, home insurance. As a matter of fact, do you have D&O insurance for public companies doing business in the state of Texas?
Yes to all those questions.
Are there navigators for any of these? Is there federal funding for any of these, or are there mandates as to what these all have to be under federal law?
Not to my knowledge.
So Obamacare is the only time, to your knowledge, that the federal government has come in and mandated with incredible detail what you must have and how you must have it for insurance in this state. Is that correct?
Certainly on that scale, yes, sir.
But you still get to be responsible for any failures of your insurance companies. They're still state insurance company licenses, right?
Yes, sir. If a company fails, we're charged with basically taking it over.
This does kind of get me sometimes. Dr. Ferris, we wrote to Secretary Sebelius asking her why there were no background checks for individuals who were navigators and assisters, and suggesting strongly that there needed to be. Do you know why, to this day, there is still no background checks here in Texas, around the country, for navigators?
Well, as we mentioned, there are a number of different agencies with which we work. Agencies like the Community Council of Greater Dallas.
No, I understand who you work with. What I want to know is, when people are taking individual information that could be directly used to do identity theft, why is there no background check for these individuals as part of it?
These individuals that work for these umbrella organizations, like the Urban League or like the Community Council of Greater Dallas, these are traditionally provide help to people in the community who need it. It would not be in their best interest to hire people who would be felons or people who would participate in the sorts of activities
Doctor,
you described.
let me follow up on that quickly. You say it wouldn't be in their interest, but in that one video, it's in the individual's best interest to pay less, and if they simply lie and say they don't smoke when they do, that's in their best interest. If you have individuals who only care about getting the highest subsidy for people and the lowest cost, and you don't check them for whether or not they're con men, how is it that the interest of protecting the interests of the taxpayer is going to align with their best interest? And, you know, with all due respect to charity organizations, nonprofits, if they bring people in, brand new people to do this is a new job, and they don't do background checks and you don't require background checks, how do we know that the taxpayer dollars are being well spent?
Well, we acknowledge that what happened with regard to the navigators in the film that you played was absolutely wrong. There's absolutely no reason for people to be encouraged to lie. That is not in anyone's best interest.
Well, it's in the best interest of the person who pays less because he lies about smoking.
But it is not in their best interest to lie about a program like this. It is totally wrong, and we acknowledge that.
Well, you said in your opening statement that, that in fact you had gone into detail and had all these things. What is it that you have insisted on these organizations doing that will prevent this in the future?
We work very closely with all of the navigators to make certain that they receive training on the protection of personally identifiable information. We make certain that
you work closely. You just said you shop this out to other individuals and they get to do it online.
CMS provides training that is
in-person training,
weekly training that we do online and that we do with webinars to train the navigators on what their responsibilities are with regard to protecting information, with regard to what they need to impart to people who would like to sign up. These take place weekly.
Doctor, I said in my opening statement that anybody could sit at the computer screen and take the test for somebody else. Anybody could be at the webinar or, quite frankly, be in the kitchen making breakfast. How is it you know that you're working closely when, in fact, they're not in the room is actually occurring?
We know because of the organizations that serve as the umbrella organizations for the navigators, which are institutions which have great reputations and work with the community and have traditionally provided good help and good care. As I said, it would not be in their best interest to hire people who would not represent them well.
Well, you know, I'm in the trust but verify business, and so far the trust has not been verified. Ms. Goodwin, I'm just going to close with a quick question to you. You mentioned it, but I think it's worth asking one more time.
Yes, sir.
Anyone in your state, in the state of Texas, who sells insurance or, in fact, even participates in that process,
correct?
The assistant that takes phone calls and provides follow-up information, if you will, your assistants, aren't they all in this state covered by the requirement that you know who they are and that they have tangible training and, in fact, they be bonded?
Yes, sir, they are. In our state, to perform any duties described as the business of insurance, you must have a license through TDI. Go through the training and go through the continuing education. If you're going to conduct the business of insurance, you must be licensed.
Well, that would have served us well, I'm sure, here in Texas. Mr. Farenthold. Oh, I'm sorry. I apologize.
Go ahead.
Did someone wanted to ask something? Mr. Vesey, it is tradition to go to the members of the committee and then the non-members of the committee, so I don't want it to be a slight, but we'll go to you right after Mr. Farenthold. Mr. Farenthold.
Thank you, Chairman Issa. I'll start with a question for Mr. Brady. You listed out a number of requirements that Texas is trying to put on navigators, and they all seem like common sense requirements that make a lot of sense, including some background checks and such. But do you think knowledge of all the information and rules within the Texas law is something that can be imparted in a 20-hour or less training session for a navigator, along with all the information necessary to be a navigator?
I guess the best benchmark that I have is the requirements that we have for insurance agents. They vary somewhat. We have a lot of different types of agent licenses, and the requirements are a little different from license to license. But one thing that is required is a pre-licensing examination, and the applicant has to pass the exam with a test.
You have to appear in person to do that?
Yes, sir. It's a proctored examination.
So unlike a navigator who can sit anonymously behind a computer and do it, you have to show up and prove who you are to take the test.
Yes, sir.
All right, let me ask you another question. If I were to go to a private insurance agent in Texas, is there a way for me to verify that that person is properly licensed with the state of Texas and has passed these exams?
The department licenses agents. They issue licenses. The agents can show the license.
All right, great. Now let me ask Mr. Ferris, is there a way for somebody to tell whether someone is a certified navigator or is just posing as a navigator? I've read some reports of some scam artists offering to get people ObamaCare cards and things like that. What mechanism is in place that I can ensure that someone I'm talking to or one of my constituents is talking to for help with Obamacare has actually gone through this extensive 20-hour training course?
Yes, the navigators who complete the training, pass the test, do receive certification that they are certified navigators. If you would like to know if the navigator that you would like to deal with has achieved that certification, they do have the certification with them. However, you can look on the Finding Local Help on the website. They can tell you where the umbrella organizations are in your community that are responsible for the navigators, and then working through that way, you can find out a particular navigator and be assured that that navigator has received the certification.
Okay, does that part of the website work?
That part of the website works.
All right, let me go now to Ms. Godwin. We've got this extensive navigator system that we have created. Was this even necessary, or is this something that could have fallen within the purview of normal insurance agents? Could you guys have taken this on, and would it have been economical for y'all to take it on, or were we forced to go to this more community organization type system?
In my personal opinion, I think agents could have taken care of it much better than it's been taken care of so far.
All right, well, those were the bulk of my questions. I don't know if we're going to have a second round of questions or not. I know we are tight on time, so I want to go ahead and let the other members get their questions in. As a member of the Oversight Committee, we've had, and I'm sure we'll continue to have, numerous hearings on this topic, and I'll have plenty of opportunity to do questions, while some of the members that we have brought in under unanimous consent don't necessarily have the privilege of participating in this committee's hearing. So I will yield back.
I thank the gentleman. We now go to the gentleman from Texas, Mr. Vesey.
Thank you, Mr. Chairman. And before I begin, I wanted to ask if I could request unanimous consent to enter the letters from the following elected officials on navigators and the critical need for the Affordable Health Care Act.
Without objection, so ordered.
And also, Mr. Chairman, I request unanimous consent to submit the following statements and letters from 7 community health care centers, clinic navigators, and other groups into the record.
Without objection, so ordered.
Thank you, Mr. Chairman. I wanted to talk specifically and ask questions about expanding Medicaid. As most of us know, one of the most critical features of the Affordable Care Act is its expansion of Medicaid eligibility to millions of low-income adults. Prior to the ACA, Medicaid eligibility was restricted primarily to low-income children, their parents, people with disabilities, and seniors. In most states, adults without dependent children are not eligible. Under the ACA, Medicaid eligibility can be expanded to cover all non-elderly adults with incomes below 138% of the federal poverty level. The federal government would pay states 100% of the cost for the first 3 years and then phase that down to about 90% in 2020, like I stated earlier in my opening comments. Are those numbers correct, Dr. Ferris?
Those numbers are correct.
Okay. Dr. Ferris, by not participating, the governor is leaving significant resources on the table that could be used for citizens here in the Dallas-Fort Worth Metroplex and across the state. Is that correct?
I can only state that every state has the ability to either accept or reject the Medicaid expansion, and in the case of the state of Texas, the decision was made not to.
And can you, and we talk a lot about this, obviously, the expansion of Medicaid, but can you tell us why the expansion of Medicaid specifically is a very important component of the Affordable Care Act?
Well, part of the reasoning behind the Affordable Care Act is to make certain that people who have traditionally been uninsured are able to have insurance coverage such that they can receive things like preventive care, such that they can get care from physicians rather than going to an emergency room when they are in extremis. When you have some sort of insurance, regardless of the type of insurance, you do have the abilities to seek ongoing care as opposed to care that is rendered once a person becomes ill, which will make the costs of care, as we've heard earlier today, much lower if people have the ability to stay healthy as opposed to try to get diseases treated. That was part of the premise of the whole Affordable Care Act, and also the premise of ensuring that people get health insurance.
One of the things that we've talked a lot about is the Medicaid expansion and individuals that are being covered or are not being covered. But I think one of the myths or maybe even illusions out there is that people are not being covered. And I wanted to ask Mr. Brady a question. As you know, Mr. Brady, under the Emergency Medical Treatment and Labor Act, people cannot be denied treatment when they arrive at emergency rooms. Is that correct?
Sir, I'm not familiar with the act. I have a general impression that people that go to hospital districts with taxing authority generally will have their emergency needs met, but it's a very rough impression.
Dr. Ferris, when people go to the medical emergency room and they're treated, these uncompensated costs, are they passed along to taxpayers? Where do these uncompensated costs go?
They are passed along. And with regard to EMTALA, that is part of my responsibility at CMS. In my role as Consortium Administrator for Quality Improvement in Survey and Certification Operations, we ensure that people who do show up in emergency rooms receive a screening exam and stabilization through EMTALA, as you have said. And that is something that we are concerned about to make certain that people have those screening exams. But part of what we hope to do is to make certain that people don't have to wind up in emergency rooms as a result of things like pneumonia or diabetes or situations that could be prevented by proper ongoing care.
Mr. Brady, I don't know if you saw this study. I know that you obviously see a lot of different studies come across your desk, but one that our staff found was that the Texas Health and Human Services Commission said that uncompensated claims for the state of Texas in 2006 were more than $11 billion. Doesn't it make good fiscal sense to expand Medicaid in our state, which would not only provide needed care for millions who don't have it, but likely keep this same population for seeking their emergency visits where they cannot pay their bills?
Sir, I work for the Texas Department of Insurance in the state of Texas. The administration of that program is done by a completely different state agency. I'm not familiar with the policy of that agency.
I thank the gentleman. We now go to the gentleman from Texas, Mr. Burgess.
Thank you, Chairman. Dr. Ferris, let me just ask you for a moment about the issue of pre-existing conditions. Texas has had a risk pool for some time, has it not?
It has.
How's that worked?
Well, the risk pool provides monies for the treatment of people who have some pre-existing condition to be able to be seen. It is not comprehensive as what we have tried to achieve with doing away with the pre-existing conditions.
Well, let me ask you a question. I don't mean to interrupt, but my time is limited.
Yeah.
Is that risk pool coming to an end?
Now, I'm not certain.
Well, I talked to Ms. Rathberger at the Texas Department of Insurance a little earlier this fall, and I suggested that I think from a statutory standpoint, yes, the risk pool was sunsetted on December 31st, the concept being that the Affordable Care Act will now pick up that slack, except that there is now growing concern the Affordable Care Act is not ready. So Commissioner Rathberger, I think quite wisely, found a way to extend that for a period of time for those people who are in the Texas risk pool. Is that correct, Mr. Brady?
Was that question directed at me?
Yeah, I was just, the extension of the Texas risk pool.
Yes, sir. There was emergency rules that were adopted to extend the Texas risk pool, I believe, for 3 months to the end of March.
So, you know, I'll just submit here, we labor under this illusion that the Affordable Care Act is going to save us from the conundrum of pre-existing conditions. But look what's happened in the federal pre-existing program. Since February of 2013, no new patient has been able to enroll in the pre-existing program. Now, for whatever reason, the press has chosen to ignore that. But we heard testimony in our committee in Washington last April from a woman with lymphoma who had been trying to wait out the waiting period to get in to the federal pre-existing program, had waited her required 6 months. When she showed up on February 1st, she was told, sorry, sister, this window's closed. You can't get in this program. We're full up. And this is the notion there that we sell stuff, but we never intend to do the follow-through. And I am truly bothered by that. And every time I hear someone bring up the issue that, oh, the Affordable Care Act's great, we're covering people with pre-existing conditions. No, we're not. No, we're not. And we're not going to. I don't know when that coverage will kick in. Now, look, I'll just tell you, I've had my own experience with healthcare.gov. I chose, for whatever reason, not to go through the congressional insurance. I'm just going to the website. It's tough. Have you done it, Dr. Ferris? Have you gone to healthcare.gov and tried to buy insurance for yourself or your family?
I have.
And what has been your result?
Well, I've been able to get through.
Did you pay the money?
I haven't yet because my son is graduating from law school. I'm hoping he'll get a job. I won't have to do that for him.
Here's the problem. If, you know, the fundamental unit of a business transaction is when the man pulls out his billfold and pays the money.
Right.
I have not been able to pay my money. Now, here we are a week away from December 23rd, and I'm wondering if I'm going to get in under the wire. Oh, by the way, we just extended that wire to January 31st. If the insurance companies happen to agree, and even if I don't get signed up by January 31st, maybe we can coerce the insurance companies to cover me retroactively. I'm sorry, that doesn't give me a feeling of confidence in the way this program is going to work. And Dr. Ferris, you and I are both physicians. You and I know how difficult it is to run a practice, how your accounts payable every month is something you sweat because you don't know whether you're going to get the cash in to keep your business open. What's going to happen to doctors' offices, hospitals, nurse practitioners after the first of the year if there cannot be assurance that this enrollment has in fact occurred because someone has paid the man the money and the coverage is in effect? Who covers that? Is HHS going to cover that? Now, you remember when Part D came online, the pharmacists kind of they were worried. They were filling prescriptions. They didn't know whether they're going to get paid or not. Secretary Leavitt, to his credit, Dr. Mark McClellan, to his credit, said we will make good on all of those prescriptions that are filled. Is the Secretary going to make good on all the care that's delivered after January 1st, for which someone, it turns out, in fact, was not covered when they thought they were covered?
Well, Congressman, I can't answer that. I'm not involved in those policy decisions at my regional level.
Well, let me just, address one other issue. You talk about people winding up in the emergency room, expansion of Medicaid. I would stress that expansion of Medicaid was not a statutory. The way Medicaid is now structured, that was a court opinion, not statutory. The statutory was the states had to do it. The court said you can't coerce the states, so now it's voluntary. So a state like Texas, there's no time limit on it like there was with the exchanges. Well, the exchanges said, you got to tell us by whatever it was, January 7th of this year, that you're going to be in the exchange. With Medicaid, there is no time limit because it was a court opinion. So another session of the state legislature, it is quite possible they could look around the country and say, you know what, we like what they did in Arkansas, we like what they did in Iowa, we'd like to modify that for Texas. So that's still a possibility, is it not?
It is.
But let me just stress, there is also the possibility, we got another debt limit coming up. I don't know whether it's May or August or October, but there will be a point where another debt limit breach is threatened in the United States Congress. And if Congress doesn't raise the statutory debt limit, there could be big trouble. Sometimes there are things that are bargained away, as you saw with the White House and the Congress during the sequester in August of 2011. What if there's a sequester that affects entitlement spending? Who protects those states that have expanded their Medicaid? What protection do they have if those federal dollars, in fact, don't flow because you and I both know they don't exist?
Again, that is not a policy question that I can answer. That is something that is done in Washington and Baltimore, not at my level.
And let me just stress, Dr. Ferris, because you and I have known each other for a while, and we have worked together in both Republican and Democrat administrations, and you are a dedicated career civil servant, and I appreciate what you have done to further the issues that you're tasked with furthering. I will just tell you, there are so many open questions about this, so many things, so many questions are unanswered, and it really wasn't necessary. We had the department, HHS, has had 3.5 years. Longer than 3.5 years now, billions of dollars, and to be no further along than we are today on December 16th is truly discouraging to me. I yield back, Chairman.
Thank you. Mr. Negebauer.
Thank you, Mr. Chairman. Ms. Goodwin, I think in your testimony you mentioned that you are required to carry liability insurance.
Errors and omissions, yes, sir.
Yeah. And why is that?
To protect my clients if I should do something that causes them financial harm.
Would you classify advising someone on their health insurance is a fairly complex transaction?
Absolutely it is.
Is it an important one?
It's a very important one.
So what protections do the people that are using navigators to basically navigate through this process, if they cause that person to make a decision that's not in their best interest?
I'm not certain of the existing regulations with regard to that coverage. I do know that the Texas rules call for a minimum of, I think, $100,000 in liability. Maybe it's 50, I can't remember, but a much lower amount than agents are generally required to cover.
But the real damage is if someone gets makes a healthcare decision that causes them to have some kind of a catastrophic loss because they didn't have the coverage that they thought they had. That's the bigger issue, is it not?
That is.
Yeah. Mr. Brady, I think you mentioned that Texas requires 40 hours of education background checks, fingerprints. You listed a litany there. Why does Texas require that?
Sir, if I could ask for a clarification, are you asking about our proposed rules, or are you asking about the requirements that apply to licensed insurance agents?
Just licensed brokers, yeah.
Two primary thoughts come to mind. One is there's a desire to make sure that the applicant for the license has the minimal educational requirement necessary to know about the business of insurance, but also there's requirements to know about the Texas regulatory environment. So that's one broad category. The other important pre-licensing function that we perform is the background check. And we obtain fingerprints. We do the criminal background checks, tapping into databases with the Texas Department of Public Safety and also the federal FBI to look to see if there are bad apples out there.
When someone takes a insurance application, I guess they get their name, their address, their date of birth. They get a lot of very personal information, and that's very sensitive information, is it not?
Yes, sir. I'll note that there's a number of laws in the Texas Insurance Code regarding the privacy of personal information, and all designed to protect that information.
Thank you. Dr. Ferris, one of the things that I think I mentioned in my open testimony you may have heard is that, we had a hearing in the Science Committee, and one of the things that we learned is that the website is got a lot of vulnerabilities to potential people hacking into that system. And so the system itself is somewhat suspect as to whether people's personal information is in fact safe with the website. But even with the assistance of a navigator, is the preference still for people to sign up for Obamacare through the website?
Well, there are actually 4 ways that a person can sign up. One would be through the website. One would be through a 1-800 number that we have that operates 24 hours a day, 7 days a week, and operates in over 150 different languages. And then people can also sign up using navigators or other application assisters, as you've heard. We've trained about 70,000 agents and brokers to help people to sign up for care, for insurance. And then the 4th way would be through a paper application. There are some people who are comfortable with paper. There are some people who are comfortable with computers. There are some people who would rather deal with a live person, such as a navigator or an insurance agent or broker, or some certified application counselor. We've trained about 19,000 of those.
So I want to go back to something you said earlier, so I want a clarification. You said that you give navigators a certificate once they've completed the course.
Right.
And so do you send them a identification card that says I am a navigator?
Well, the certification that they receive states that they have completed the navigator training and have successfully passed the examination.
So if I wanted to go online and say, for example, Dr. Burgess, if he's a certified navigator, could I ascertain that?
Could you do
In other
what?
words, is there a website where if somebody identifies themselves as a navigator and I wanted to verify that, is there a place where I could go say?
In order for a person to actually sign up with a navigator, they have to do it in person. They don't actually do that over the phone. When you deal with a navigator, you sit and you deal with them face to face. And so that way the person could show you their certification that says that they've actually, and you can set up an appointment to go in and see them so that you can be certain that you are dealing with who you think you are.
But I couldn't verify that. In other words, because unfortunately there are people in this country that know how to counterfeit things. And so I guess, so there's not a way for me to go and ascertain whether someone is actually who they say they are?
I'll have to check on that. I can get back with you on it just to make certain that there's a way to verify it.
So is there a way for me to go to some place in a Texas website and determine whether someone is a licensed broker or agent in the state of Texas?
So as I commented earlier, one of our jobs is to protect consumers, and one of the services that we provide is an opportunity for members of the public to access our website to see if insurance companies are licensed, if insurance agents are licensed. We try to put that out as a check to make sure that the public knows they're dealing with trustworthy individuals.
And so what we're learning is that same protection is not afforded to people that are dealing with navigators, I guess, because there's really not a way to verify those folks. Thank you, Mr. Chairman. Appreciate that.
Thank you. Dr. Ferris, do you have pictures of all the navigators?
I do not.
Do you have fingerprints of all the navigators?
Not
Do you have Xerox copies of their driver's licenses?
I would have to check on that. I don't
know. My understanding is if somebody's just a plain fraud and they walk in and say, I'm Joe Smith, but in fact they're Sam Jones, and Sam Jones is a felon, and they just come in with a false name, they can go through this process and they can take the test and get certified. Now they have a certificate. Is that certificate something that I can go online and see what it looks like to verify that the one they're showing me is the same? Or they just print it out when they graduate?
I would need to check on that as
I'm
well.
pretty sure they just print it out and when they graduate. Well, let me go through a couple of questions. You're a longtime career federal employee. Are you CSRS or FERS?
FERS.
So you're FERS, so you're covered by FEHBP?
Yes.
So why would you go on the website when you're covered by the Federal Employee Health Care Benefit Plan? And how would you buy under Obamacare when the only health care plan you have is the FEHBP?
I wouldn't buy it for me. I was looking at it for my son, who's...
Okay, so you went on the website pretending you were your son?
No. I did not go on the website.
You went on the website and you had to put a name in. You didn't put your name in, did you?
I did. We have the same name.
Oh, okay, so you're a person covered by the Federal Employee Health Care Benefit, and you went on the site and said, I'm checking this out. What did you put in for your salary?
Well, my son has no salary. He's a law student.
Okay, so you put in your name, but no salary.
Right.
Okay, and I appreciate your candor. These are some of the things we've been looking at is apparently you had no trouble getting into something. I notably tweeted out the error I got trying to go on, but you can go on, you can say you have no salary, you can say you're somebody, and had you gone through and completed it, you know, you'd have had health care. At least you'd have had the coverage.
No, but I didn't.
Okay, well, thank you for your honesty of not doing it. Sometimes you just can't make these things up. Now, we do a census every year, every 10 years. But we don't use subcontractors to ask people about where they live and so on. We actually hire you through the census system, isn't that right?
Yes.
And because my committee oversees that, we're well aware that we do take that identifiable information. We do have specific records, and we do attempt to run background on people who work for the census, even though all they're really doing is going to a door and asking census information. Does it concern you that today anybody can, in fact, become a navigator, and they could be somebody with a felony, somebody who's in the business of identity theft, and you don't have a picture of them, you don't have their fingerprints, so if later on, sort of like that video showed us, if later on you discover that, in fact, they're crooks, and then they simply disappear, you're not going to be able to go fire them or ask that they be suspended. Is that right?
Well, I go back to what we originally said in terms of the organizations that we work with who hire these people, that they would do necessary checks to make certain that they're not hiring felons, which they usually don't.
Right, and I've got one last question, Doctor. You use the word suspend for these individuals. Now, I'm kind of a funny guy. You know, the people that screwed up Benghazi, they got suspended, except they didn't lose a day's pay, and they're back on the job today because their suspension ended. When you say suspend, do you mean they were fired, or do you mean that they were suspended, that nebulous state in which they're not currently out there advising people to do crooked things?
I'm aware that one of the persons in training was fired, and I know that they were all decertified so that they can never be navigators or any type of in-person assisters. But I think the term suspend was correct, except for the one that I know was fired.
Okay, so one was fired, the other may still be being paid to do something, including they could be administering this information. And I'll be brief. There's 4 ways to get to your insurance, but they all go to the website, right? Ultimately, if you call up, the person you talk to is on the website. If you work with the navigator, they turn the paper into the website. Ultimately, everything goes through the website, so if there's a security vulnerability or corrupt information in any way, shape, or form, it's all the website, right? So just want everyone to understand that.
Except that the website does not store any information. It certainly does not store any personally identifiable information. The data services hub is used to test information that a person puts in, but it does not store it, so it doesn't leave it vulnerable.
Are you aware that people have received other people's information? One person signs up in one state and somebody else gets a confirmation in another state?
No, I was not aware.
No, you need to watch a little more Fox, I'm afraid. With that, we now go to Mr. Sessions.
Mr. Chairman, thank you very much. Ms. Goodwin, you and other of your Texas certified agents, as they perform their duties, are they asked specific information before there is an offer or a sell, things like whether a policy has specific coverage, a specific doctor, or a specific hospital for coverage?
A part of our process as an agent or broker is to evaluate all of the carriers that we represent to our clients, to gather the information about the contract coverage, how it's covered, how prescription drugs are covered and what those levels are, and a particular doctor or series of physicians, are those physicians and hospitals in the network for that carrier? That's part of our job.
Are you aware of something that might be known as a deceptive trade or sales practice? Thank you very much. Dr. Ferris, thank you for being here today. I have worked with you in my years of service as a member of Congress, and I've found every time that you have not only been available to me, but you have promptly tried to assist me or explain to me any impediment that was placed in its way. And I want to thank you very much for being here today. Dr. Ferris, how long have you worked for the federal government?
17 years.
Some 17 years. And during that time, you have been a valuable asset, I know, to your organization. Did they in any way approach you as they were putting together the Navigator program and ask your feedback, or were you pre-trained in any way?
No.
No. Did anyone from Washington, D.C. ever tell you this is part of the plan about how we're going to go and roll this plan out?
No.
Have you taken part in the training or seen the specific training that the navigators were given?
I have, yes. I've not taken it myself, but I have seen.
You're aware of that training?
Yes.
And do you consider it leading edge and, in your professional opinion, on par with the ability for people to offer insurance plans and to be able to discuss this that was part of what is known as the ObamaCare? Do you believe that they were well trained?
Well, what we want people to be able to do through the Navigator program, number one, is explain healthcare insurance to people who may have never been insured and who may not understand what health insurance is all about, to explain what could be available to them in terms of various affordability options, the various tax credits, as well as just general information about insurance, health insurance in general, and to get them signed up. So there are a number of different facets that are involved in the Navigator training that involve not just enrollment, but also education and outreach to people such that they are aware of the existence of the ability to have some health insurance.
Yes, sir. You'd used the word general, and I used the word specific when addressing the questions to Mrs. Goodwin. Can you tell me that the navigators then, as opposed to the term general, were they specific in their ability to provide information about doctors, about coverage, about hospitals, about how things would happen?
No, the answer to that would be no.
No. So in other words, we have navigators who are out and in essence selling, offering a product or service in the state of Texas, and they cannot offer a specific, but rather a general idea about what this insurance might include. Is that your testimony?
It's designed to be an impartial program where they are not directing anyone to a specific product, but to help them to make choices and to understand that there are choices that are available to them and to understand the whole insurance market, not to put them into a specific plan. The navigators cannot make that choice for them. As a professional for 17 years, are you aware of, and would you consider yourself as the federal representative on behalf of CMS, that you have a specific understanding of how a coverage would work here in Texas, specifically? I don't think well, clarify the question a little bit. Well, the word specific is the word that I used for Mrs. Goodwin, and it is specific coverage, specific doctors, specific hospitals. Not that you would know them off your head, but that you could accurately go and look these items up and issues up as the professional on behalf of CMS in the state of Texas. No, I don't believe I could. So, in other words, your testimony is here today as the professional on behalf of CMS. You could not provide that information, and yet Mrs. Goodwin would be required by the law to offer very specific information. I think that would be true. That would be a fair statement. Do you believe that we provided you ample opportunity before, as we announced this hearing today, that we properly and professionally approached you? Yes. Okay. I would like to ask, if I can, Mr. Brady, a question.
Without objection.
And that is, Mr. Brady, as you find people who are selling products and services that are within your area that might be health and other insurance matters, does it disturb you that here we are even at the backside of this process, that professionals in the state of Texas that represent the federal government are incapable in testimony today of providing specific information about products and services that would be offered in the state of Texas that is within your purview?
Sir, I think it'd be best to answer that by saying that if someone wants to act like an insurance agent, there's a rigorous pre-licensing examination process and pre-educational process that they have to go through. The navigators are actually, pursuant to our proposed rules, prohibited from acting like an insurance agent unless they obtain a license. And then if they obtain a license, then these proposed navigator rules would not apply. The reason I note that is I think it hits to the heart of the issue that I believe you're raising, the differences between specific knowledge and a more general knowledge. If we want someone to be giving specific advice, we under the proposed rules, would say they're going to be held to a higher standard, they're going to be licensed as an agent.
Mr. Brady, are you aware of a letter that was sent by some 13 attorney generals to the Secretary Sebelius on or about August the 4th that related to questions about navigators?
Yes, sir, I was provided a copy of the letter.
Would you be surprised if I told you that 3 months later these attorney generals have not been replied to by the Secretary?
It's difficult to respond to, sir.
Mr. Brady, if you were asked by an attorney general to provide information back by 13 attorney generals, would you believe you would have a diligence placed upon you to respond back to legal authorities in their own states?
Yes, sir.
Mr. Brady, I have one last question, and that is for you and Dr. Ferris, and perhaps it relates to me and perhaps it does not. But there are many, many families who have disabled children who count on specialty hospitals, children's hospitals, that have special tools, special doctors, special beds, special equipment. Would it surprise you if I told you that many of these children's hospitals are not covered, nor will they be included in the proposals for the Affordable Care Act, that they were intentionally excluded? Would that surprise you?
Sir, was that directed to
Mr. Brady, would that surprise you?
I think the best way for me to answer that is we're hopeful that the public can get their health care needs met, and would be concerned if there's gaps in network coverage.
Mr. Brady, would that surprise you, yes or no, if a children's hospital to a large measure was not included?
It would tend to surprise me, sir.
Thank you, sir. Dr. Ferris, would it also would surprise you?
It would surprise me, yes.
It would surprise you. Thank you very much. Mr. Chairman, thank you very much.
I thank the gentleman. I would note that we had a previous hearing in which doctors, including a major facility in Florida and another one in New York, testified to exactly that they were excluded, specialties were excluded by the exchange insurance quotes in order to drive down the price, and that's we'll send you a copy of it for the record. Mr. Vesey, do you have an additional questions?
Yes. Yes, thank you, Mr. Chairman. I did want to ask some navigator questions. Dr. Ferris, I know that it's been suggested that the Navigator program is somehow unprecedented and that it is a parade of horrible from community organizations and nonprofits from providing consumers with information on how they can get enrolled. But Dr. Ferris, I wanted to ask you specifically what types of Texas organizations applied for Navigator grants under the funding announcement that CMS has released.
Well, a number of organizations like the United Way of Tarrant County, the Community Council of Greater Dallas, the United Way of Central Texas, the Brazos Valley Council of Governments, the City of Houston Department of Health and Human Services. I can tell you that in Arkansas, the University of Arkansas.
All large, national, reputable organizations
Yes.
that have a very broad experience in helping individuals
Yes.
in a bipartisan, nonprofit type manner that has very, very good reputation, particularly United Way in the Metroplex here. Did these organizations have to submit information regarding their experience and history?
They did, and they were all vetted by a panel of experts. Their applications were screened. The proposals that they submitted were evaluated to make certain that they could provide these services in a cost-effective manner, and their track records in terms of being able to deal with the community and all facets of the community were looked at to make certain that they had that ability as well.
I know that one of the things, again, that has been suggested is that this is unprecedented for the federal government to use navigators and what have you to help people sign up for insurance. But let me ask you a question. Didn't the federal government use assistance in the enrollment of the Children's Health Insurance Program, or CHIP, back in the late 1990s in the state?
It's my understanding that they did.
Okay. I think that we all can agree that the Affordable Care Act is a heavy lift as far as getting people enrolled and what have you, because you're talking about enrolling millions of people at once, many of whom have never had insurance in their lives. We should obviously encourage data security, navigator training, but we should also not attempt to impede implementation. Dr. Ferris, are the recent actions of the state unprecedented in seeking to limit public access to the federal program?
Well, all states have the ability to look at the program and to make a determination as to whether or not they think that the procedures and the parameters should be more stringent than the ones that have been proposed. And I know the state of Texas has taken a look. They have reached out to CMS as well as to CSIO for some discussions, and it is actually probable that as we are speaking today, the state of Texas is sitting down with people at CSIO looking at ways that they can work together with regard to the Texas proposals.
I know that many state elected officials have expressed concern that the recent actions of Texas Insurance Commissioner Julia Rathgerber, and I would like to submit into the hearing record a letter signed by 54 members of the Texas House of Representatives requesting an extension of a December the 20th deadline for public comment on Navigator.
Without objection, so ordered.
Mr. Brady, have you seen that letter that's signed by 54 Texas legislators?
Very briefly, sir.
Okay. That's all I have, Mr. Chairman.
Thank you. We now go to the gentleman, Mr. Farenthold.
I just have a couple of quick follow-ups. Mr. Ferris, you've testified that you can become a navigator by taking an online webinar with no fingerprint. Y'all don't even keep a copy of the driver's license. There's no photo. Is there even a description of the person on the navigator certificates?
I am not aware. I will be happy to check to find out exactly what we do keep.
And it's my understanding that a member of our staff here at the Oversight and Government Reform Committee in under 3 hours was able to complete the Navigator course, and his certificate was simply printed out on a laser printer. Now, I'm no expert forger, but I know how to use Photoshop. This one sounds like you might be able to do it with a pair of scissors, Scotch tape, and a photocopier. Don't you think we need to know who the navigator we are? We're trusting with our personal information and discussions about our health care needs?
I'm really intrigued by the fact that you say they were able to do that in 3 hours and print it out themselves. I'd like to get some more information on that if I could and share that with our folks.
I'll have the committee get in touch with your office and share that information with you. Now, are you familiar with the Office of Personnel Management within the government?
I am.
You know, they have a nice little side business where they run background checks. Now, we've had some issues with how well they do it, but there is a pretty sophisticated procedure that run background checks very frequently. Is there any reason HHS didn't decide to avail themselves of that for checking out folks, again, that would be required to have access to your personally identifiable information?
Those sorts of policy decisions are made at CSIO, and they don't involve
I understand. We not all good decisions. Okay, most decisions that come out of Washington may not be. Anyway, we won't go into that. Let me ask one other quick question, and I'll ask this one to Mr. Brady. What are the remedies now that you're aware of that a consumer has against a navigator who either gives them bad advice or appropriates information? I notice Ms. Godwin has to carry insurance. I think she says she has tens of thousands of dollars or more worth of insurance. What are our remedies against navigators, and what is the guarantee that they have the resources to pay those damages should someone prevail in pursuing them?
Sir, earlier I mentioned that Senate Bill 1795 from the last Texas legislative session charged us with looking at the federal requirements.
Yeah, but that hasn't been enacted yet. So if you go to a navigator now, you don't have that protection.
Yes, sir. What I'm leading to is that one of the insufficiencies that we identified was what I'm going to call a lack of recourse. Because of that, the proposed rules that I briefed earlier would require financial responsibility. It can be in the form of a $100,000 errors and omissions policy, professional liability policy that includes errors and omissions coverage. There's a couple other options, but it was because of this gap, if you would, that we've decided that we would propose a rule that would put some financial safety net programs in place.
Unfortunately, under the law, I have to go into the DC exchange, or I think I would probably be availing myself of a professional agent instead. But of course, I'm complying with the law, and I'll yield back.
I thank the gentleman. Mr. Sessions, you had one more quickly.
I did, Mr. Chairman, and there are really more comments related to some feedback that I've heard today. And the first,
I'll finish up the questions and I'll let you close, because this is really something you helped put together. Dr. Burgess.
Thank you, Mr. Chairman. Mr. Farenthold brought up the concept that through the Office of Personnel Management, the background checks are done and could be done. Gary Cohen, who's the head of the Center for Consumer Information and Insurance Oversight, earlier this year testified that he didn't think that they had the authority to require Navigator and sister organization to conduct background checks of individuals, and they didn't know whether they had the funds to do this. Now, this is interesting because July 4th of this year, Robert Pear, writing in the New York Times, talked about a British company called Serco. Serco, we had into our committee, the Committee of Energy and Commerce, that was talking to the contractors who were involved in the rollout of the Affordable Care Act. And Serco, their only job is to put take paper applications and put them in for people. It turns out that's a pretty expensive process because we're paying Serco a lot of money to do that on a per application basis. It's in the thousands of dollars. But nevertheless, every Serco employee has to have a background check. They have to be fingerprinted and they have to have a background check. So I would just submit that although Mr. Cohen didn't think it was reasonable or feasible to do that with navigators, certainly the Department of Health and Human Services required that of Serco. It was good. Let me just ask you a question, because Dr. Ferris mentioned, dealing with people who have not had a lot of experience with insurance policies. So I guess we might use the term insurance literacy, that part of the job of the navigator is to explain what the policy contains and what it covers. This is what a broker does as well. I mean, the concept of being able to explain, say what a 60% actuarial value policy really means to the person who's buying it. Would that be your experience?
To whom are you addressing?
I was addressing it to Ms. Goodwin, but anyone's free to answer it. Now, if you've got a policy that's 60% actuarial value, and that's what you're buying because it's the cheapest one on the block, somebody needs to tell that purchaser what that 60% actuarial value means, correct?
Yes.
And what it means is that that person may have a significant deductible. I mean, more than significant. I mean, astonishingly high as far as a deductible, $6,800 on an individual policy. And they also may be required to spend significant amount of money on coinsurance in addition to their deductible. Is that not correct? The answer to your question is yes.
That is correct.
Now, the president, because he loves us, said he was going to put a cap on out-of-pocket expenses, except that the president suspended the cap on out-of-pocket expenses for the first year. So those people buying a 60% actuarial value policy in the bronze level, the bronze medal level, may be in for a significant amount of sticker shock when they actually go to the doctor. They've been making their premiums, or they get their subsidy for their premiums, and then they get a kidney stone at 2 o'clock in the morning, they show up in the ER, and they get a bill for $3,500 or $4,500 that they have to pay. They may have difficulty understanding that concept, may they not? Are the navigators going to explain to them that this is a possibility? Would a broker explain that, Ms. Goodwin?
Absolutely.
Dr. Ferris, would a navigator explain that?
I'm not certain that a navigator would.
So what is likely to happen to that $4,500 bill from the doctor and hospital that comes to that patient if they don't know that it's coming? I'll tell you what, they're going to walk the check. It happens all the time. So the uncompensated care that was talked about earlier in this discussion, there's nothing in the Affordable Care Act that's going to make that go away. In many ways, it may get worse if we're not doing an adequate job of explaining. The brokers and agents, I feel comfortable will. I'm not sure that the navigators themselves understand that or are given enough instruction to be able to impart that to their customers. Thank you, Mr. Chairman, for the additional time. I'll yield back.
Thank you. Mr. Nagelbauer.
Thank you, Mr. Chairman. Dr. Ferris, when did you first hear about the news where people at this Dallas navigators were telling people to lie on their applications? How did you come to have that knowledge?
I actually saw it on the news.
You saw it on the news?
Yes.
And so I think you issued a letter, asking for them to take corrective actions. Have you followed up to see if they've taken those actions?
Yes, they have taken those actions. They are, again, they have decertified the people who were involved. There are weekly reports that they have to submit to us to let us know about the specific training that they are providing now on an ongoing basis to make certain that they understand what their responsibilities are with regard to personally identifiable information. We also have pretty much weekly check-ins with them, and we reserve the right to do site visits.
That was my next question. Are you doing audits to follow up and make sure that these actions are actually being taken?
Yes.
Just with this agency, or with all of the?
With all of the navigators. In fact, there was a program on Friday that was a webinar where we talked about, with all of the navigators in the country, what had happened at the National Urban League to make certain that this is never repeated again, so that they understand that these sorts of things.
So are those site visits of people from CMS going to traveling around the country doing that, or is that, how does that work?
That will actually be managed out of CISIO, and they will determine who goes and when. But the site visits will need to be unannounced visits in order for them to have any validity at all.
And so, when you find those actions, then what is the step? I mean, is there a process to revoke if you find an agency is not properly following those? Can they revoke those?
There are a number of different remedies that are in place, starting with the corrective action plan. But if we find really egregious problems, we can certainly revoke the licenses that they have in order to provide these services.
Off the top of your head, can you tell me approximately how many site visits that have been done?
I can't. I'd have to get that information from CISIO. I don't know.
Could you get that for me?
We'll be happy to get back with you on that.
Thank you. Thank you, Mr. Chairman.
Thank you. Mr. Sessions.
Mr. Chairman, thank you very much. I want to thank all three of you for being here today. I would like to say that there have been a couple things said here which I would take issue at, and one of them is that a statement was made that critics, perhaps they were in reference to members of Congress, are attempting to make it more difficult for the American people to sign up for Obamacare. And I would like to plainly state that as a result of the testimony, Mr. Chairman, that we've had here today, I find that the navigators, which is why we're here today, are incapable of properly and professionally selling a product that people can count on, that they can understand. And I find it's nonspecific. It cannot provide a person information about a physician, about coverage, or about a hospital. And I'm deeply disappointed that, and want to make sure that no one would draw the conclusion that it is someone else other than the federal government and the president and the secretary themselves who are making things far more difficult and who I believe are impeding progress. They're selling a product. And in the state of Texas, I believe it would be deceptive for them to do this. A deceptive trade practice would be against the law, and that's what's happening. Secondly, a viewpoint that these navigators are nonpartisan and simply representative of just regular everyday groups in America that are nonpartisan and non-political, but in fact, Planned Parenthood is receiving millions of dollars across the country. And for us to try and sell the idea that all this is just a good neighbor type of reaching out and talking with people, I find is not only deceptive, it's not true. I yield back my time.
I thank the gentleman. I'd like to thank our witnesses today. You've been asked tough questions. We've stretched your roles in many of those questions, and I appreciate your attempting to answer. There are many problems with the Affordable Care Act. We knew it would be hard. I don't think any of us knew it would be this hard. We are less informed than we'd like to be on a lot of areas, but we are more informed because of your testimony here today. As we continue to look at the navigators, as the state of Texas and other responsible insurance commissioners and agents begin to look at what the proper role is for a navigator, I don't envy you your job. To the extent that they're simply taking information and having it forwarded to a computer to see if you can get cheap or free insurance, subsidized or Medicaid, I think that's not insurance. To the extent that they have any level of competency in advising people on whether to go with a bronze plan or a gold plan, whether or not something would be covered, whether or not a particular hospital or specialty would be covered, whether it's right for you and your family, I do share with the state of Texas and the Insurance Commission that this is a serious question that falls under the state's responsibility and historic knowledge. And I would hope that Texas would find a way to make sure that what they can do, they're allowed to do, and what they cannot do without further training, identification, bonding, and the like, that Texas asserts its full authority. Dr. Ferris, I want to particularly thank you. This was not easy. You came here to answer tough questions at a time in which a program is new, but it is a program that I think we all understand affects countless millions of people, and although it has promise for some, it has peril for many. And with that, I would also like to thank the Texas delegation. I found myself saying, the gentleman from Texas, the gentleman from Texas, the gentleman from Texas, and I think back to when I interviewed with Johnson & Johnson in Sherman, Texas, and I'm saying, there but for that getting hired by Johnson & Johnson, one of you could be my congressman. I thank you. We stand adjourned.